I'm just going to quick show you when you're unboxing your CytoPen NG. This is our NG. We often promote this specifically with our hair restoration bundles with the Hair Pro and with the Cyto Serum, because when you're doing treatments on the scalp, you don't need a whole lot of depth of penetration and you don't need as much torque as you have with the S2. So your CytoPen NG, here it is. You do have the capability of going all the way to 2.5 millimeters. And you do have multiple speeds, so there's 6 speeds. I can actually show you that. And 1, 2, 3, 4, 5, 6. When you're doing scalp treatments, you're just going to stay on 1. So typically, you know, the thinner the skin, the lower the speed. The thicker the skin, the faster the speed. Inside your box, you're going to have your user manual and your protective sleeves. So here is your sleeves, and you just slide your pen right into those on a per treatment basis. You have your base with your power adapter and cable. So the base is actually going to allow you to sit the pen on top of it, and then you do have your power cord. So here's these guys, and then your base. So you can sit it looks super nice in the practice. And then you'll just have that plugged in so it's charging overnight. And then you'll have your microneedling tips. So 10 actually come with the package. And they're all sterile and individually wrapped. I will suggest that anytime you do a treatment, you log the lot number on the patient file. Just in case anything goes awry, you can let us know, etc. But you'll know that it was a different lot number every time, because again, these are single use tips. I am going to go over the S2. So we talked about the CytoPen NG, which is one of our FDA cleared pens. The CytoPen S2 is our premier pen for a number of different reasons. It does have the steel encasing. It has a German motor inside, so it's meant to be a workhorse. It has more torque than any other pen in the space. So if you want to provide a nice aggressive treatment with microneedling, this is your guy. You know, a lot of people in the space say a pen is a pen is a pen. Well, one, if it's not FDA cleared, God forbid something happen with your malpractice, they're not going to cover you. So make sure that your pen is FDA cleared. Some people prefer corded because they think that if the battery runs out or as the battery gets low, that they're not going to get the same power delivery. You have that capability. So you have a different end where you can plug it in and it can be corded. With that being said, we also have battery power because a lot of people don't want, or they think that the cord is cumbersome. It's also important to know that the battery will never run out or get low or provide less. It will just shut off, right? So as long as it's charged, you get lots and lots of usage. It will last the entire day. This one does have 3 speeds, so 1, 2, and 3. Again, the thinner the skin, the slower the speed. The thicker the skin, the higher the speed. So forehead, eyes, 1, body, 3, mid-face, maybe 2, okay? This does have a dial that allows you to go all the way from 0 to 2.5, and you can do it at 0.1 millimeter increments, so you can be as exact as you want to. The S2 also has 3 different tip capabilities, where the NG only has 1. The S2 has 2 microneedling tips, a 12 needle tip and a 36 needle tip. If you've ever seen a 36 needle tip, there's a lot of needles inside there, so you're going to get a really aggressive treatment. A lot of times your patients are going to have a lot more pinpoint bleeding with that. They're going to have, instead of 1 day of downtime, maybe 3 days of downtime, but their overall result is going to be phenomenal. It does have the 12 needle tip. So if they don't want a lot of downtime, just that, minor sunburn for 24 hours, you have that capability as well. And then lastly, what I love about this pen is the 3rd tip is the nano tip, which actually functions like microdermabrasion. So you get 2 systems in one for such an affordable cost. So your ROI on this pen is just sky high through the roof. When we use either one of our pens for microneedling, we're going to always use the stem facial products. So we have two products. These are not necessarily skincare so much as they are an instrumental part of the treatment or a treatment in and of themselves. So while you're doing the treatment with the pen, because the two primary capabilities of microneedling is collagen induction therapy, where the holes are puncturing the skin and you get that collagen and elastin production, okay? But the other is transdermal delivery of topicals. So you saw our little roller of the stem facial. There's 5 vials of that in this. And you're going to roll that on the skin before you microneedle and then after you microneedle to shove those growth factors into the skin to help heal and rejuvenate the skin. Again, there's lots of peptides and other amazing active ingredients in the stem facial matrix. And then when your patient walks out the door, our recommended treatment protocol is 3 microneedling treatments done a month apart. This duo will actually last them the entire 90 days as long as they're using a half a pump of each per day, twice a day, okay, so morning and night. So your one is basically the same thing as your stem facial matrix, except that it has 1 additional peptide. Both of these are water-based, so they get absorbed into the tissue. That's what you really want. And then 2 is actually an oil-based barrier. There's growth factors, there's peptides in here too, but it functions as a barrier for your skin. Again, this is something that when you send this home with your patient, you're ensuring that they're going to have amazing results after the fact, that you have some level of control on how they're dealing with their skin afterwards. So, necessary combination.